All right, let's dive right into this explainer. Today, we're unpacking a wild contradiction in modern healthcare. On one hand, we've got technology that feels like it was ripped straight out of a science fiction novel. But on the other hand, we have a medical establishment that is, in many ways, still stubbornly clinging to the Dark Ages. We're going to look at how some of the absolute most invasive traumatic surgeries have been replaced by near-painless outpatient miracles, and why your doctor might actually be keeping you in the dark about them.
Here's the roadmap for our explainer today. We'll start by saying goodbye to barbaric surgery. Meet the evangelist of the eye. See how needles are replacing knives. Look at safe surgery for spines. Uncover the medical resistance holding it all back. And finally, learn how to empower the patient.
Section 1. Goodbye to barbaric surgery. Let's see how we're finally moving past the medical dark ages.
To really appreciate the sci-fi medicine we have available today, we've got to look back at the pretty brutal medieval stuff that used to be the gold standard. Take couching, for example. Cataracts are super common as we get older. The lens of the eye basically clouds over, blocks light, ruins your night vision. So back in the day, they did this couching procedure, and it is exactly what it sounds like. They'd literally just shove the cloudy lens backward into the eyeball and just leave it sitting there. The patients were left with no lens at all, needing thick Coke bottle glasses just to see anything. Plus, they faced a massively higher risk of their retinas detaching.
Yeah, you heard that right. Ophthalmology fellow Dr. Mohammed Haji confirmed this brutal reality. Quote, "You just push it backward into the eye and leave it there." Wild, right? Now, at the time, this was considered a massive breakthrough, kind of like inventing the first 800-pound typewriter. But as Dr. Haji tells us, shrinking things down is the real future of medicine.
Moving on to Section 2, the evangelist of the eye, seeing the future clearly.
Let's look at how fixing cataracts went from a major ordeal to a blink-and-you-miss-it miracle. The shift here from blunt force to microscopic precision is literally mind-blowing. It really wasn't that long ago that surgeons would slice a massive 180-degree cut right across the eye to open the whole thing up, which took about 45 minutes. But today, they use instruments that are less than half the size of the needle they use to draw your blood. They make a tiny 2mm incision, slide in a vacuum catheter, and basically just slurp the cloudy stuff out in like 4 to 7 minutes. And the capsule of the lens stays perfectly intact, ready for a high-tech replacement.
Which brings us to 82-year-old Beryl Hamilton. She is an absolute evangelist for this new Restore bifocal lens. And honestly, who can blame her? She wore glasses for almost 50 years, spending hundreds of dollars replacing them as her vision kept degrading. But after this quick 7-minute procedure, they popped that microscopic bifocal lens into her eye. And just like that, she didn't just get her old sight back, she basically got superhuman vision compared to where she started. She can read the finest print, she can see far away, all without glasses. This tech is so life-changing that patients like Beryl basically turn into walking billboards for the procedure.
All right, Section 3, a needle instead of knives, revolutionary reproductive care.
Now this minimally invasive revolution, it absolutely isn't just for eyes. It's totally transforming gynecology too. We're zooming out from the microscopic eye to a major internal organ, the uterus. Up to 50% of women deal with uterine fibroids, and these tumors can cause just agonizing suffering. Take Allison, for example. She's a school teacher who always prided herself on being super healthy and strong, but the debilitating bleeding from her fibroids completely upended her life. We're talking periods lasting up to 10 days, bleeding so incredibly heavy she was using adult diapers, missing work, and even rushing to the ER. It entirely drained her vitality and put a massive roadblock in her personal life for half of every single month.
For the longest time, the go-to fix for this was a full hysterectomy. That means going under general anesthesia, taking a scalpel, surgically removing the entire uterus, spending weeks in painful recovery, and permanently losing the ability to have children. But enter interventional radiology. Instead of a surgeon's scalpel, they use a needle. In a procedure called uterine artery embolization, or UAE, you literally just get a local numbing shot. The doctor threads a tiny catheter up the femoral artery right into the arteries feeding the uterus and injects an agent that clogs up the blood supply to those fibroids. No general anesthesia, no cutting, and you go home the exact same day.
And it took exactly 18 minutes. Seriously. 18 minutes. That's how fast Dr. Sal Sclafoni, the chief of interventional radiology at SUNY Downstate, finished Allison's UAE procedure, giving her same-day freedom with 0 surgical cuts. Because the fibroids are starved of blood, they shrink. Allison had maybe 6 hours of mild discomfort, and that was it. Compare that to weeks of brutal recuperation for major surgery. It's just a monumental leap forward for patient care.
That brings us to Section 4, safe surgery for spines, rebuilding the back without the butchery.
So let's talk about the absolute most feared medical arena out there, spine surgery. If there's one thing that terrifies people the most, it's having their back operated on. And historically, they had every reason to be scared. Take a patient like Faverlyn Miller. She was dealing with agonizing pain from a condition called spondylolisthesis. That's a mouthful. But basically, one vertebra slips right forward onto another. Bone grinds on bone, and it literally smashes down on the nerve roots. Imagine getting your hands slammed in a car door and having that feeling all day, every day. That was Faverlyn's reality. She couldn't even stand up long enough to just wash her dishes.
The traditional fix for this was essentially medieval butchery. Surgeons had to make a massive cut right down the middle of the back and quite literally fillet the giant paraspinal muscles off the bone. Ripping those muscles away causes massive trauma and permanent atrophy. But Dr. Mike Gerling, who specializes in minimally invasive spine procedures, explains a totally different approach. Now surgeons make a tiny incision, under 2 centimeters, slide in a small dilator and do the whole surgery through a tiny tube while staring at a high-definition TV screen. The muscles are just gently pushed aside, not cut or torn. The result? Patients are literally getting up and touching their toes the day after the procedure.
And the miracles don't stop at the tiny incision. Back in the day, to get bone for a graft, doctors would have to painfully chisel it right out of the patient's pelvis, leaving them with horrific hip pain. Now, they completely skip that. Modern science uses bone banks and stem cells. They literally suck out a bit of the patient's marrow, spin it in a centrifuge to isolate the stem cells, and then mix those with a bioengineered chemical called bone morphogenic protein. They place that internally to literally fuse the spine together. No brutal bone harvesting, no massive external collars. It is straight up science fiction happening today.
Section 5. The medical resistance. Why aren't you being told about this?
So if we have all these sci-fi miracles available, fixing eyes in 7 minutes, curing fibroids in 18, rebuilding spines painlessly, the obvious question is, why are so many patients still getting steered toward the Dark Ages? Why is the medieval standard of care still happening in the 21st century? Well, the medical establishment has massive inertia. First off, specialists are trapped tightly in their own silos. Gynecologists are in the business of doing gynecologic surgery, right? They rarely refer a patient over to an interventional radiologist who uses needles instead of scalpels. Second, there's a real fear of new tech. As Dr. Gerling pointed out, spine surgeons who trained 20 years ago really don't want to take months off work to completely relearn their hand-eye coordination to look at a TV monitor instead of an open wound. And third, patients are heavily gaslit. When Faverlyn Miller had her severe physical pain, doctors sent her to a chiropractor, physical rehab, and incredibly, even a psychiatrist. They completely dismissed her agony as being psychological.
Allison's fibroid story is a textbook example of this system completely failing. She went to 2 separate gynecologists for her extreme bleeding. Do you think either of them mentioned the uterine artery embolization? Nope. They both swore that completely removing her uterus was her only option. Allison literally had to stumble upon this life-changing UAE procedure by pure luck at a local health fair. It just proves that some doctors will absolutely withhold life-changing alternatives if those treatments fall outside their specific surgical business or their personal comfort zone.
Which leads us right into Section 6, Empowering the Patient, Becoming Your Own Medical Advocate.
This brings us to the absolute biggest takeaway from this entire explainer, the critical importance of self-advocacy in modern healthcare. You simply cannot assume that the first doctor you see is handing you the most advanced, least invasive option available. Look at Faverlyn. She went from not being able to stand and wash dishes to walking perfectly straight the very day after her microsurgery. She avoided a life in a wheelchair specifically because she absolutely refused to stop questioning her doctors. When they handed her endless bottles of Motrin and treated her like she was crazy, she kept searching until she found a surgeon who actually listened and used modern technology. Her message to anyone in pain is so vital. Do not give up. Make them understand the pain you're in until someone actually listens.
The technology for these painless, minimally invasive miracles is already here. We are quite literally living in a time where we can vacuum out cataracts in a few minutes, shrink tumors through a tiny catheter, and rebuild a spine without a massive incision. But the medical system is huge, it's slow to change, and let's be real, the financial incentives often point heavily toward those older, more invasive surgeries. So it really falls on you to be the informed patient. Ask the tough questions. Seek out second opinions from entirely different medical specialties. Demand the sci-fi healthcare future that you actually deserve. So, I'll leave you with this. Will you just accept the medieval standard of care, or will you demand the sci-fi solution?